Oh, finally. Sorry about that. I did say that I was going to go live at 5, but couldn't quite get onto Facebook live for some reason. Not sure exactly why, but yeah. So I am here at home, which was not going to be the plan. I was supposed to be in clinic, so you get a lovely view of our home before it's being done up. Hi, Christine. Oh, I really wish this was more interactive. Um, but okay, so I want to talk about goals and goal setting. In the usual fashion, don't really have anything planned, so I'm just going to wing it. Uh, I think one of the things that I have struggled with a lot over the sort of years of working, particularly working in sort of more chronic, persistent, complex pain, is figuring out. It's coming to a kind of a a goal setting. So figuring out what it is that the other person actually wants to do or wants to achieve. Um, it sounds really simple, right? So you go to physio school and they're like, oh, you need to, get yourself a goal, make sure it's smart and, get it all written down. And it sounds really simple, but what I've noticed is that actually goal setting and the word goal and asking the person in front of you, client, your patient, however you label them, the people we work with, like when you ask someone what's your goal or what do you want to achieve, actually often what you get is this really like non-verbal communication. They just don't really know what it is, and it's led me to this place where I think actually goal setting is a really, really intimate and personal part of the process. And I think sometimes we might just sort of go in a little bit, I don't know, cavalier, classic sort of physio. It's on our list. It's what we've got to get done in the first session. Got to get to that goal. Got to figure out what that goal is straight away. And I'm not sure that we should be doing it that way. I've sort of felt like over the last couple of years, the way that I approach goals is a little bit more gentle and a little bit more, yeah, a bit more compassionate, really, because I think sometimes the other person doesn't even necessarily know what their goal is. They might not have even been in a situation where they've been able to think about making goals and making plans. And so sometimes we do have to dose titrate our sort of like need to get them to an action based goal. I think we have to take our time with that a little bit. Um, because it's not about the goal, right? It's not about the action. It's so often about the motivation. It's so often about the real personal bit, the why do you want to do this goal? Um, I don't think we get to that in the first. I don't know if you're seeing patients in half an hour, 45 minutes. I see them in an hour, sometimes longer. It's really difficult to get to that personal like motivation, that personal side. And it's a real trust thing. People need to be able to trust us in order to say what one of their desires is. Um, and I think in pain, desire, need, want, these kind of things are so often, yeah, like so often people don't feel that they're allowed to have those things. They don't feel like they're allowed to want something or desire something or need something. Um, so we have to, I think we have to be way more respectful and way more conservative in our approach to goals. And I wonder whether actually we probably shouldn't be doing this on the first session. Maybe we should be taking our time and letting it just nurture, letting it grow, giving it space to come up, like letting us really get to know that other person, like spend a little bit more time with them and see how they respond and how uh, what sort of things do they laugh at, what sort of things do they enjoy, when do their eyes light up when you talk about doing something. Your goals really comes out of your subjective assessment. It really comes out of the who that person is, the what makes them tick, the what is something that is so meaningful and so important that they are going to keep working towards that and keep going towards that goal. They're going to hold on to that. Right, that goal, that goal is the thing that's going to get them moving step by step by step, right? So it's going to get them to opening up, allow the person opening up their life, opening up what they want to do, exploring new things, potentially having more pain, potentially having more anxiety, potentially having more difficult emotions, difficult experiences. So that goal has to be strong enough in the beginning to sort of pull them through this process. So we have to be really, really careful that we don't fall in with the kind of superficial, it makes sense because I'm in a physio room goal. And with my clients, and bear in mind it's my style, with my clients we call this the bullshit goal. It's like, you're in this room, so you're going to give me a goal like, I don't know, I want to be able to go cycling. Okay, that might be really important to you, but tell me, why is it important to you? You know, it might be that your goal is to be able to sit down on an airplane for an hour because you want to go and see your mum who lives far away. Or it might be that your goal is to be able to go into a tube station. That might be your real goal. But what you're giving me is a goal that makes the most sense in this context. And that might not be the thing that you actually really want to work towards. So it's our job as clinicians to be able to say, okay, this is something that we can put down for now. But as we get to know each other, I want to know what the value is in this goal. So why would you want to do that? So, you know, I think we have to be really careful that it's not about the goal. So asking someone what your goal is, it's not just about getting to an activity or an action that makes sense, that we're going to work towards, or that's achievable. God, I hate that part of the SMART idea, it must be achievable. How the hell do we know what is achievable? And aren't we already setting our sights too bloody low if we say it has to be achievable? If it was achievable, they'd have already done it. Like, why would we want to do that? We want to get to the place where we're like, okay, this is important. This is close to who I am as a person. That's why it's so difficult for me to move towards it. But that's why I'm going to move towards it, because it's so important. So it's not necessarily about what goal can we do? What can we do in this room because we've got this equipment? What can we do in this physio clinic because we've got this equipment? It has to be about what that person wants. And so we have to stop twisting their goal into something we can achieve. So if their goal is to go and have a meal in a restaurant, we have to facilitate the exposure-based steps, the ways towards that. I think, and that might be in the very beginning, it might even be just talking about being in a restaurant and what that feels like, and what are the challenges that come up, what are the things that are going to be difficult. It might be that we have to recreate restaurants. It might be that we even have to go to a restaurant. Why can't we do that? Why do we have to stay in a physio clinic or in a clinical room? Why, you know, if that's something that person wants to do, and we're committing our career and our life to helping people achieve their goals, then really we probably need to be a little bit more flexible as to how we do that. So we have to stop twisting our goal, I think, because the point is that as we move forwards, that person is going to experience the same kind of challenges and struggles that we experience when we move towards one of our goals. So if, say, for example, your goal is to learn something really difficult. Okay, so say your goal is you want to learn, I don't know, my goal right now is I want to be able to read a Carl Friston paper without like my mind exploding. The problem is that in order to do that, I have to actually read some of these papers. And every time I get towards it, I'm like, oh God, there's just so many words, all the words. And then I just want to turn away from it all the time. So it's not, so the skill in me is about turning towards it. The skill I need to facilitate, the motivation that I need to facilitate, is about being able to turn towards that difficult stuff so that I can start. So the step towards me being able to read one of those papers might even just be downloading it and acknowledging that it already feels really difficult. And then it might be, you know, one paragraph at a time. It might be reading it without worrying whether I understand it or not. So doing it without it being perfect, accepting that there are imperfections and that's okay. These are the kind of steps that we might be working towards as we take that goal that should be difficult, should feel hard to do because it's meaningful, it's important. If it's not bringing up this sense of, oh, but I'm really worried I might fail, or it's probably not really very important. In which case, are we enriching somebody's life, or are we just giving them more stuff to do that's taking them away from the thing that they actually really want to do? Because the more physio experience exercises we give them, the more stuff we fill people's day with, the less they're able to actually spend the energy and time on turning towards the stuff that's really, really important, which is hard work, man. It's exhausting. You know yourself, don't you, when you try to do something that's hard and difficult but important, it's tiring, and you need like mental space to do that. Well, if we've given them wall squats 3 times a day 10 times, and it causes pain, and it's hard for them, and it's not necessarily meaningful, have we enriched their life? Have we helped them move towards their goal? Or have we then given them a bullshit goal that makes us feel better because it's physio, so we feel more in our comfort zone? But actually, are we really helping them and nurturing the skill towards moving towards their goals? And I reckon you could argue that some of the time we are doing that. We're giving them a practice experience that's safe, that doesn't necessarily come with so much difficult stuff, so it's like a kind of exposure. I think that that's absolutely true. We could be doing that. But I do think sometimes we're actually just taking them away from the stuff that's important. So we have to get to a place where we can measure value. So a values-based goal is not necessarily just, does this fit with my life values, but do I value this goal? And a really, really super simple way of doing that is just 0 and 10, right? So how much do you value? How important is achieving this goal to you and your life? Not to you and your experience with me as a therapist, but to you and your life. How important is achieving this goal? So 0, not important at all. 10, the most important goal. You're going to stop everything in order to achieve this goal. You're going to go through everything in order to achieve this goal. That is the most important goal in your life. I reckon you probably need to be somewhere around a 7 for us to be able to overcome some of the challenges and difficult stuff that comes with taking new steps. So we've got to figure out, not only does this fit with my life values, because otherwise that would be a bullshit goal, which fair enough, we all make them, I make them too, but also, do I value this goal? So do we know that this is an important thing, something that we're going to work towards? And then our job is to not twist it. Every step of the way, what's 1% more that we can do of this goal? What's 1% more that we can do of this goal? And really, really sticking to that one goal. And that's how I think we move forward, is that we first of all we give ourselves time to figure out what's important. We give the person in front of us time to trust us. We give them time to unravel bits of their lives that we can anchor into, and it gives us time to really come up with something that's unique and special, and worthy of and respect, and pays respect to the human in front of us, and the fact that they have developed their whole life moving towards stuff that's important to them. And then we have to really be careful that we don't twist it and break it down into all these little sections so that it no longer even looks like their goal. If you're saying, oh, my goal is to be able to wash my hair, and then as a physio we go, oh right, well we need shoulder flexion. God, I can't remember what it is. We need shoulder flexion to do that. We need rotation. Yeah, we do need all of those things, but we need them in the context of brushing someone's hair. Otherwise, they're just random abstract movements that have very little motivation behind them. And if we don't get to the motivation, we're not going to stay in line with the goal, and then we're not going to keep going when it gets difficult. So context, motivation, making sure these things are valued and important and fits in line with the person. The only way you're going to be able to do that is if you give yourself more time. Don't rush to get through your goals. Don't be like, we've got to nail this goal in the first setting. That doesn't make any sense in terms of developing a relationship with another human being. Essentially, you're strangers. These kind of things take time. We need to be able to be strong enough in our autonomy and our voice to say, yes, we need more time. I need to get to know the person in front of me and let it grow and build. So leave that box empty on your first session. Why not? That could be the person's homework. That could be, you might even have to dose titrate how you move towards goal setting. It could be that the goal is to make a goal. Yeah, maybe I've got a bit ranty. I've been on one this morning. So, but yeah. I don't know if that's helpful, but with things like acceptance and commitment therapy and ACT, what we're really, really doing is we're really knuckling down into what it is to be that other person. What is it like to live their life? How meaningful is this goal to them? How much does it fit in within what I have learned and started to understand about this human? So that we can really navigate away from avoidance and towards psychological flexibility. So we're moving away from the avoidance of doing difficult but important stuff, and moving towards the psychological flexibility that we need in order to do important stuff that might come with difficult things. So yeah. Oh, I see, Christine, you just said something. It's funny because as physios, we're under pressure to create the achievable steps on a task that people are not well practiced in. That's why it's a challenge, because they're likely not practiced in it much. Good point. So it seems almost impossible to know what these steps would be before we actually try to do it and see what the barriers are. Yeah, like that's exactly it. You've got to, you have no idea what is achievable and what is not achievable to that human. I mean, I know in my clinical experience, I've seen some people do some incredible feats. Like human beings are incredibly able to adapt and move towards stuff. So let's not limit people by saying it needs to be achievable. Let's say, yeah, we can go for the goal you want, and maybe we'll fail, but you know what, we're going to deal with that failure, because that's what having a good understanding of acceptance and commitment therapy does give you. It gives you that behavioral change theory, that framework, that communication, that compassion focused approach that says, okay, well, we tried. That doesn't mean we can't try again. That doesn't mean that we can't change it and try again. We don't need to change the goal. We just need to keep tweaking and figuring out and working towards it. I think this is it's a really important skill to be fostering, that, you make a goal, you break it down, you have a go. Maybe it works, great, you move on. Maybe it doesn't work, okay, then we just figure it out again, or we try again. This is not something we should be avoiding, but we're frightened of it as clinicians because it makes us vulnerable. Yeah, and I think that's something that we need to foster within ourselves. We need to nurture ourselves in that way. But yeah, great point. Okay, well, thank you very much. And I hope this is useful, and I hope it's helpful. And if you've any questions or anything that you want to say, just wing it in the comments, and I'll be happy to try and work them through with you. But other than that, hope you have an absolutely lovely evening, and I'll probably be on waffling again at some point soon. So bye.